Hello everyone, thank you for joining me. My name is Dr. Samara White and I'm a pharmacy resident here at Buffalo Psychiatric Center. Today I'm going to be talking about depression and antidepressants. First, we'll talk about what depression is, then we'll talk about the different types of antidepressants, how they work, what side effects you can expect, and then a couple of other important things that you should know. There are many different types of depression. Major depressive disorder is the most common type of depression, and when people usually talk about depression, they're usually referring to this disorder. Next, there is persistent depressive disorder, which used to be called dysthymia. It's a more mild but longer-lasting form of major depression. Premenstrual dysphoric disorder is a type of depression that occurs around someone's menstruation. It's a more severe form of PMS. It's very intense and can sometimes even be disabling. Seasonal affective disorder is a depression that occurs during certain seasons of the year, usually fall or winter, and that's because it's thought that shorter days and less daylight contribute to this type of depression. And finally, there's postpartum depression, which usually occurs after giving birth, but can occur before as well. And it's typically thought that the decrease in the hormones estrogen and progesterone are what cause this form of depression. But today we're going to focus on major depressive disorder. Everyone feels sad sometimes. For example, you may feel sad when you get bad news, when things don't go your way, when you experience a breakup, or even grief from a loss of a loved one. But these feelings usually pass with a little bit of time. Depression is different. The symptoms of depression do not go away on their own. Depression can cause very severe symptoms that can affect how someone thinks and feels, and it can even affect their ability to carry out daily activities. In very severe cases, this can even affect someone's ability to perform basic hygiene tasks, such as showering or brushing their teeth, or even their ability to get out of bed. People with depression commonly withdraw from their social support systems and even lose hope for the future. These are the typical symptoms of major depressive disorder. Of course, there's low mood or feeling sad or hopeless. There's also a decreased interest or pleasure in someone's usual activities or hobbies. Depression can cause sleep problems, either sleeping too much or too little. It can also change your appetite and cause you to gain weight or lose weight. It can cause you to be fatigued or have a lack of energy, feel guilt and worthlessness. It can cause a brain fog that makes it hard to think clearly or to make decisions. And it can change the speed of anyone's movements or their speech pattern. And it can also cause thoughts of death and suicide. In order to diagnose depression, a person must have 5 of the 9 symptoms that we just talked about, and these must last for at least 2 weeks. These symptoms must also cause a decline in someone's normal level of functioning. An easy screening tool that a lot of clinicians use is called the Patient's Health Questionnaire 9, or PHQ-9, and 9 represents the 9 symptoms of depression. The PHQ-9 is scored based on how often someone has experienced the 9 symptoms of depression within the last 2 weeks. Each of the 9 symptoms can be rated from 0 to 3 points based on not experiencing them at all, experiencing them for several days, more than half the days, or nearly every day in this 2-week period. And once a score has been given to each of the 9 symptoms, you simply add them up to get a final score. If the total score is in the range of 0 to 4 points, this means there is no detectable depression. If it's in the range of 5 to 9 points, there might be a mild depression. If it's in the range of 10 to 14 points, this is when we would consider it to be moderate depression. 15 to 19 points would represent moderate to severe depression, and 20 points and above represents severe depression. Generally, about 5% of adults in America experience depression. There are some differences in the rates of depression between populations. For example, people aged 18 to 29 are 3 times more likely to have depression than people aged 60 and above, and women are up to 3 times more likely to have depression than men. Depression can happen at any age, but it typically starts to show in the 20s. And no one is immune from depression. It can affect everyone, regardless of their age, race, income, culture, or education. Depression can be genetic or influenced by environments or experiences, such as having a traumatic childhood, but there isn't always a specific reason for depression that you can pinpoint, and this is because it's caused by an imbalance of brain chemicals. And it's important to remember that depression is a very serious condition. It's important to seek professional help, especially because people experiencing depression have an increased risk of suicide. But there's a lot of stigma and shame that unfortunately prevents a lot of people from seeking help. So now that we've covered the basics of depression, let's talk a little bit more about the brain chemicals or the neurotransmitters that are affected in depression. And this will also help us understand how antidepressants work. Neurotransmitters are chemicals that carry messages between nerve cells in the brain in order for the body to function properly. There are 3 main brain chemicals that are thought to play a big role in depression. The first one is serotonin, also known as the feel-good or happiness chemical. Low levels of serotonin are associated with depression, but it's not known if depression itself causes low levels of serotonin or if low levels of serotonin cause depression. And although we usually think about serotonin as mainly helping to regulate mood, it also plays a role in many other bodily functions. It's involved in appetite and digestion. It controls bowel function and bowel movements. It's even linked to diseases such as irritable bowel syndrome. And interestingly, most of the body's serotonin is actually produced and stays in the stomach and intestines. Serotonin also plays a role in bone health and can contribute to osteoporosis, a disease that weakens the bones. Serotonin is a precursor to melatonin, a chemical that helps regulate the body's sleep and wake cycle. Serotonin is even involved in how the body forms blood clots to help wounds heal, and it's even involved in sex drive. Norepinephrine is a neurotransmitter and a hormone that helps the body respond to certain situations, environments, or actions. It's known as the fight or flight chemical because it helps determine what your response is to danger, either fight, attack, or flight, run away. Norepinephrine controls your nervous system in order to provide the body with enough energy to respond accordingly. In response to danger, norepinephrine initiates a stress response to help you protect yourself. So this dilates your pupils so you can see better. Your skin turns pale because your blood goes to the major organs that will help protect you. You get a burst of energy. Breathing gets deeper and faster. Your heart pumps faster. Blood pressure increases so that your muscles receive more blood flow and oxygen. And norepinephrine also shuts down digestion, so more energy can be used to keep you safe. Norepinephrine also plays a role in stress, attention and focus, alertness, memory, reaction time, and pain tolerance. And it can also affect mood and sleep. Abnormal levels of norepinephrine can cause many disorders: anxiety, depression, ADHD, memory problems, headache, insomnia, changes in blood pressure and heart rate, or even blood glucose. The last brain chemical is dopamine. Dopamine is involved in many body functions, but it's best known for its role in interest, pleasure, reward systems, movement or motor control, and memory and learning. Abnormal dopamine levels can lead to conditions such as ADHD, Parkinson's, restless leg syndrome, and schizophrenia or psychosis. So now that we know the main chemicals that are involved in depression, let's talk about how the brain actually uses these chemicals. This is a picture of two brain cells, also called neurons. They communicate with each other and determine how someone acts based on the neurotransmitters or brain chemicals that we just discussed. The end of one neuron connects to the beginning of another neuron. The presynaptic neuron is the end of the first neuron. The postsynaptic neuron is the beginning of the second neuron. There's a space in between the neurons called a synaptic cleft. The neurotransmitters are located within vesicles or sacs in the first neuron. And the receptors are where the first neuron is sending the neurotransmitters in order to communicate or carry out a function. In order for the communication to start, the vesicles containing the neurotransmitters move towards the end of the first neuron. Once they reach the end of the first neuron, the vesicle then releases the neurotransmitters into the synaptic cleft. We can think of the neurotransmitters in the synaptic cleft as the neurotransmitters that are available for the brain to use. The neurotransmitters can bind to the receptors to send their signal. The neurotransmitters can only send their signals when they bind to their receptors. We can think of it as an electric plug going into an electric socket or an outlet. And then after they send their signals, the neurotransmitters are released from their receptors and then go back into the first neuron through a transporter that moves the neurotransmitters from the synaptic cleft back into that first neuron. And then they eventually go back into a vesicle and the cycle continues. And this is basically how all of our brain cells work and communicate. Now that we understand how the brain cells work, we can talk about antidepressants. There are many different types of antidepressants that we use to treat depression, and these are the different classes of these antidepressants. We'll start with the SSRIs, or selective serotonin reuptake inhibitors. To understand how these work, we have to go back to the picture of the cells communicating. Like I mentioned before, we can think of the neurotransmitters that are in the synaptic cleft as the ones that are available to work or perform a function. And there's a transporter that removes the neurotransmitters from the synaptic cleft and puts them back into the first neuron, therefore decreasing the levels of neurotransmitters available within the cleft. SSRIs block this transporter from removing the neurotransmitters from the synaptic cleft, and this is where they get their name. They inhibit or prevent the reuptake of serotonin from the synaptic cleft back into the first neuron. And therefore, we have more neurotransmitters, in this case specifically serotonin, where we want them. Here are some examples of different SSRIs. We have citalopram, also known as Celexa, escitalopram, also known as Lexapro, fluoxetine, also known as Prozac, fluvoxamine, also known as Luvox, paroxetine, also known as Paxil, and sertraline, also known as Zoloft. Because these SSRIs work on serotonin, they can affect some of the roles that serotonin normally plays in our bodies. So this helps explain some of the side effects such as nausea, sexual dysfunction, weight gain, increased bleeding, headaches, and sweating. You should also know that SSRIs can be used to treat anxiety as well as depression. And you should also know that fluvoxamine is the only SSRI that's not used to treat depression. It can only be used to treat OCD, obsessive compulsive disorder. Next, we have SNRIs, or serotonin norepinephrine reuptake inhibitors. SNRIs work similarly to SSRIs. The only difference is they increase both serotonin and norepinephrine. And they do this by blocking those reuptake transporters. So this increases the amounts of serotonin and norepinephrine. And SNRIs block the reuptake of serotonin and norepinephrine both equally. Since norepinephrine causes those nervous system responses, we see some of this in the side effects, such as increased blood pressure, anxiety, and insomnia. And because it still has the serotonin component, we still see similar side effects as SSRIs: nausea, sexual dysfunction, and bleeding. And what's unique about SNRIs is that some of them can be used to treat fibromyalgia and nerve pain, also called neuropathic pain, which causes tingling, prickling, and burning sensations, or even numbness. Some example SNRIs are desvenlafaxine, or Pristiq, duloxetine, or Cymbalta, levominastipran, or Fetzima, milnastipran, or Savella, and venlafaxine, or Effexor. Next, we have a class of antidepressants called TCAs, or tricyclic antidepressants. These work similarly to SNRIs, but they block the serotonin and norepinephrine transporters at different levels or amounts, rather than equally for serotonin and norepinephrine like SNRIs do. Some example TCAs are amitriptyline, also known as Elavil, clomipramine, also known as anafranil, diazepamine, also known as norpramin, doxepin, also known as Sinequan, imipramine, also known as tofranil, and nortriptyline, also known as Pamelil. And since TCAs still have that norepinephrine component, and perhaps even more so than some of the previous antidepressants, it can cause a lot of heart problems and increased blood pressure. It can also cause dehydration, so we see constipation and dry mouth as well. Some other side effects are insomnia, anxiety, and weight gain. And elderly patients should avoid using TCAs due to these side effects. A safer class for elderly patients are SSRIs. Next, we have serotonin modulators. And modulators just means that they can alter or change certain properties. In addition to the regular SSRI mechanism, these also act by altering the activity of various serotonin receptors on the postsynaptic or second neuron. Some example serotonin modulators are nefazodone, also known as Serzone, trazodone, also known as Oleptro, vilazodone, also known as Vibride, and vortioxetine, also known as Trintellix. And since these only work on serotonin, we see some of the same stereotypic serotonin side effects: nausea, diarrhea, sexual dysfunction, and headache. You should also know that trazodone is often only used for sleep, and this is because its antidepressant effects are not seen until high doses are reached, unlike its sedation or sleepiness properties, which are reached at low doses. Next, we have our MAOIs, or monoamine oxidase inhibitors. In the presynaptic neuron, there's an enzyme that breaks down the neurotransmitters before they are released. We can think of this enzyme as a Pac-Man. If we stop that enzyme, or Pac-Man, from breaking down the neurotransmitters, we can increase the amount that go into the synaptic cleft. Some example MAOIs are isocarboxazid, also known as Marplan, phenelzine, also known as Nardo, selegiline, also known as Imsam, and tranylcypromine, also known as Parnate. Some side effects are dehydration, which again can cause constipation and dry mouth. We also see low blood pressure and weight gain. It's important to avoid foods that are high in tyramine, such as aged, smoked, or pickled foods while on MAOIs, and this is because it can lead to severe hypertension, which means extremely high blood pressure to the point of an emergency. Also, it's important to avoid taking MAOIs within a couple of weeks of other antidepressants, and this is due to increased serotonin and risk of serotonin syndrome, which I'll talk about in a few slides. And finally, we have some miscellaneous antidepressants that don't fit into any of these other categories. First, we have brexanolone, also known as Zulresso, and this is for postpartum depression only, not for major depressive disorder. Brexanolone can only be given through the veins, which is intravenously, and some side effects are trouble breathing and sleepiness. Next, we have bupropion, also known as Wellbutrin. Bupropion is a dopamine and norepinephrine reuptake inhibitor. Bupropion can also be used for smoking cessation in addition to depression. And it's important to know that people with seizures should avoid taking bupropion. Some side effects are insomnia, anxiety, and increased blood pressure. Next, we have esketamine, also known as Spravato. Esketamine is a nasal spray antidepressant, and since it's a controlled substance, it's only used in cases of very severe depression that hasn't responded to any other antidepressant. Some side effects are dissociation, which means feeling disconnected or detached from reality. It can also cause sleepiness and increased blood pressure. And finally, we have mirtazapine, also known as Remeron. Some side effects of mirtazapine are weight gain and sleepiness, and sometimes we use these side effects to our advantage, especially in patients who need to gain weight or who need help sleeping. What's interesting about mirtazapine is that increased doses leads to less sedation or sleepiness, and decreased doses leads to more sedation or sleepiness. In cases of depression that are hard to treat or that do not respond to one antidepressant, we can also add on medications such as some antipsychotics, a mood stabilizer such as lithium, or T3, which is a thyroid medication. Here are some other things that you should know about antidepressants. Antidepressants from different classes can be used at the same time, and this is especially helpful in cases of hard to treat depression that also don't respond to just one antidepressant. You should also know that it can take weeks for antidepressants to begin working. We usually don't see the full benefit of antidepressants until 4 to 8 weeks. It's also important to know that physical symptoms such as sleep, energy, concentration, all resolve before mood symptoms do. Also, in people who have bipolar disorder, antidepressants can cause a manic episode if they're not used at the same time as a mood stabilizer. Although there's a warning for increased risk of suicide with antidepressants, especially early in treatment or if the person is 24 years old or younger, there's likely a higher risk of suicide if depression goes untreated. The main takeaway point is that depression is important to treat in order to reduce risk of suicide. And if you or someone you know has thoughts of suicide, it's important to get professional help immediately. The National Suicide Crisis Lifeline is 988. Another thing you should know about antidepressants is that you should never stop taking them abruptly. And this is because it can lead to symptoms of withdrawal, especially for antidepressants that are serotonin-based and TCAs. And on the screen are some symptoms of withdrawal that you can look out for. The last thing that you should know about taking antidepressants is that you should always talk to a healthcare provider about what medications you're on, and always take them as directed in order to reduce the risk of serotonin syndrome. Serotonin syndrome is very rare. It usually only happens when someone is on 3 or more serotonin-based medications, but even though it's rare, it's a very serious condition, and it can sometimes even become fatal. Before we wrap up for the day, I just wanted to briefly go over a couple of other treatments that are sometimes used in depression. There are some non-prescription medications that people use to treat depression. These are available over the counter, but you shouldn't rely on them because they're not as effective as antidepressants are. And remember, always talk to your healthcare provider about any medications before you try them, because some of them, especially St. John's wort, can negatively affect other medications that you're on. And lastly, here are some non-medication based methods of treating depression. Talk therapy is highly effective, especially when used with antidepressants. Therapy can help you learn healthy coping skills and learn other ways to manage depression. Some other methods are electroconvulsive therapy, also known as ECT, and this is highly effective as well. In fact, it often works better than antidepressants. It basically helps reset the brain chemicals back to normal levels using controlled electric shocks. There's also transcranial magnetic stimulation, or TMS, which is similar to ECT, but it uses a magnet instead. And of course, there are healthy lifestyle modifications that are always recommended, no matter what other treatment you use. These are things such as having a healthy diet, getting enough sleep every night, exercising regularly, having social support systems, using mindfulness, meditation, or any other form of stress reduction. So now we've made it to the end of today's lesson on depression and antidepressants. So let's wrap up with some quick review questions. Which of the following is true regarding depression? A, depression is not real. B, depression is the same thing as experiencing sadness. C, depression affects men more than women. Or D, depression is important to treat in order to avoid risk of suicide. The answer is D. It's important to treat to avoid risk of suicide. What is the National Suicide Crisis Lifeline phone number? A, 900, B, 911, C, 988, or D, 999? The answer is C, 988. Which of the following is known as the feel-good or happiness neurotransmitter? A, dopamine, B, norepinephrine, C, serotonin, or D, histamine? The answer is C, serotonin. Which of the following is not a class of antidepressants? A, SSRIs, B, SNRIs, C, MAOIs, or D, beta blockers? The answer is D, beta blockers. What does SSRI stand for? A, selective serotonin reuptake importers, B, selective serotonin reuptake inhibitors, C, selective serotonin reuptake increasers, or D, selective serotonin reuptake imitation? The answer is B, selective serotonin reuptake inhibitors. Which of the following is true regarding antidepressants? A, they can take up to 4 to 8 weeks to work. B, some can help with anxiety. C, they normalize levels of brain chemicals. Or D, all of the above? The answer is D, all of the above. And the last question is, which of the following are lifestyle modifications that can help manage depression? A, exercising regularly. B, getting 8 hours of sleep every night. C, having a healthy diet. Or D, all of the above? The correct answer is D, all of the above. Thank you very much for watching. I hope you've learned a lot today. And remember, if you ever have any questions, always talk to your physician or pharmacist. Thank you and have a great day.